In the state of Kerala, it was a different story. They'd had their first case 2 months earlier and immediately quarantined anyone thought to be infected. They set up a comprehensive welfare system to support those self-isolating. Kerala's run by the Communist Party and has always prioritised social services. Usha Kumari is one of more than 30,000 social worker activists, known as Ashas. They're key to the battle against COVID. Today she's checking up on Lakshman. He's recovering from COVID. Usha's job is to make sure everyone who needs to isolate in her patch does so. She gets their shopping, collects their medicine, anything they might need.
Side effect ആയിരിക്കാന്ന് മാമൻ പറയുന്നു. മാമ ഞാൻ പോവാണ്. എന്താവശ്യം ഉണ്ടെങ്കിലും മാമൻ എന്നെ വിളിക്കാം. എന്താവശ്യം ഉണ്ടെങ്കിലും ഏത് പാതിരാത്രിയിലും മാമനെ വിളിച്ച് കാര്യങ്ങൾ അന്വേഷിക്കണമെങ്കിൽ അന്വേഷിക്കാം. ടാറ്റാ ബൈ ബൈ. ഹായ് ടാറ്റാ.
Lockdown, making people stay at home, is the main reason we've been able to contain COVID. I would say lockdown is almost 100% effective.
99%.
Kerala's health minister is having a breakfast meeting with her team. 3 years ago, she dealt with an outbreak of another deadly virus here. She learned lessons. Now she's using them to fight COVID. What did you do to contain those early cases?
For 14 days, we quarantined the people who returned from outside. The ASHA workers helped very much. They were working in the field to make it sure that the quarantined people were staying in their houses, and we adopted a program called Break the Chain.
The public were encouraged to break the chain of COVID transmission through simple messaging. This video of the police went viral. And people were given free umbrellas to help with social distancing. Community kitchens supply meals for people stuck at home or in hospital.
300-350 ഊണ് നമ്മൾ വിൽക്കുന്നുണ്ട്. പിന്നെ ഹോസ്പിറ്റൽ മെഡിക്കൽ കോളേജ് അതുപോലുള്ള ഹോസ്പിറ്റലിന് വേണ്ടിയിട്ട് നമ്മളോട് ഭക്ഷണം ഓർഡർ ചെയ്യാറുണ്ട്. അപ്പം അവർക്ക് അവരുടെ ഊണ് കൂടുതൽ ഓർഡർ വരുമ്പോൾ ചില ദിവസങ്ങളിൽ 500, 550, 600 വരെ ഞങ്ങൾ നൽകാറുണ്ട്.
From free food to mental health counselling, Kerala has provided a complete support system to help reduce new infections.
We need to keep the rising or the curve of the pandemic below the health system threshold. For that, we adopted some special strategies to reduce the peak and also to build up our health system.
Hospitals here were able to cope with COVID patients. The spread of the virus was contained because people self-isolated when they were told to. Hospitals continued with other medical procedures throughout the pandemic.
Kerala was working from the beginning itself to save the lives and livelihood at the same time. That's why we declared so many social security activities and measures to save the economy and also save the lives of the people.
35 million people live in Kerala. Around 4,500 have died here from COVID. It's one of the lowest death rates in the world. The UK's is 15 times higher.